Hello, my name is Megan Reedling, and I'll be presenting on animal-assisted interaction in healthcare. I'd love to educate you today so that we can implement the animal interactions and interventions at the Porter Health and Rehab Center. Thank you for your time, and I hope you enjoy the information. Does interaction with animals among healthcare patients reduce anxiety about procedures or current medical conditions greater than no interaction with animals? So, Section A, our problem description. The people that would be interested would be our patients, family members, staff, and healthcare facilities, of course. The reasons that they would be interested would be for increased participation in socialization, increased participation in activities or therapy services, increased quality of life, decreased dependency on staff, and decreased anxiety and stress. This first article was a cohort study that addressed the correlation with animal-assisted therapy on psychiatric patients, considering that stress and anxiety are considered contributory factors to cardiovascular disease. The reduction in anxiety scores for the patients with psychiatric disorders was twice as great after animal-assisted therapy as after therapeutic recreation scores. This study was a randomized controlled trial. The clinical investigation was to determine if animal-assisted therapy or interventions were effective in promoting social communication between children who experience language impairments with typically developing peers. Their conclusions resulted that animal interactions were beneficial to increase the proper utilization of language with those participants who experienced a language impairment. Therapy dogs can add a great complementary therapy for children undergoing surgical procedures. The animal-assisted therapy facilities rapid recovery of vigilance and activity after anesthesia. An adaptive cardiovascular response was also noted. This study concluded animal-assisted therapy improves cardiopulmonary pressures, neurohormone levels, and decreased anxiety in patients hospitalized with heart failure. The research found animals being present decreases psychological indices such as heart rate and blood pressure. Dog ownership was directly related to increased life expectancy. This research was completed with cross-sectional study, and some of the research and history of bringing pets into the mix. There was a story told about a little boy who would not talk until there was an animal around. This actually happens a lot in healthcare, especially with those patients who have cognitive limitations. This article was a literature review that provided the synthesis of current state of the science with animal therapy in pediatric patients. One of the weaknesses of the study was found maybe the child not want to participate or may have allergies. This study was able to conclude that animal-assisted activities make a difference to the depression levels of residents in long-term care facilities. This article was a randomized controlled trial, and the strength of the article was using this type of method for the validity. A weakness would have been the amount of types of interaction that animals did have in the study. This study addressed animal-assisted therapy with people who have been diagnosed with intellectual disabilities with psychosocial outcomes. The conclusion is that there was a positive improvement from all studies that concluded cognitive, behavioral, and social and emotional components. This is our proposed solution. So the benefits of the animal-assisted therapy, interactions, and socialization would give decreased anxiety to patients, calm the patient, increased benefits of therapy or activities, and then also would benefit healthcare facilities by making them more marketable for more services provided. The organization culture. The proposed solution is consistent with the organization that would be a healthcare facility providing skilled rehab services, long-term care, and assisted living to attempt and implementing this intervention to increase patients' quality of life. The expected outcomes of the project are decreased anxiety for those patients that have been diagnosed with a new condition, decreased anxiety for those patients participating in therapy or activities, as well as those that are going for new procedures. The expected outcomes are listed as above, as just mentioned, and then the method to achieve those would be to incorporate the change into the company, compile research and literature review, provide these educational sessions with leadership, and then request a trial period to move on to a more permanent plan. This is the change curve model, which was created to make the journey of change easier for people and organizations to adapt and grow as well with the organization. So stage 1, you see shock and denial of change, not very receptive. Stage 2, they react negatively. There's fear and anger, sometimes even protest or just really resentment against the change. Stage 3, they stop focusing on the loss and begin to accept the changes that are coming. And this is where you really start to see people reaping the benefits. Stage 4, they embrace the change and start rebuilding their ways. So the setting, of course, would be in the Porter Rehab, in health services, long-term care, assisted living, and or skilled rehab. The amount of time it would take would be about a month and would include 2 to 3 weeks of 5 days a week for measuring the actual data with participants, those receiving and not receiving animal interactions. The resources would be needed would be human help as far as education, analyzing data, staff, resident participation, as well as the animals. The methods and instruments would be used via questionnaires and surveys, which we will see in the appendices. Process would be beginning with training and then moving on to actually doing the interaction and having the research project manager oversee those. The outline and collection of data will be initiated by the project creator and maintained in a folder. There will also be a witness to that collection so that nothing will be tampered. All answers are correlated with a number as to provide an easier way to see growth and or growth in the end. And a scorecard will also be kept, which you will see in a minute. Barriers and challenges would be that staff are not willing to participate or implement the program. And also, if we include rehab patients, they may not be the facility for the entire time that we plan on collecting the data. The implementation of the plan cost will be addressed in one of the appendices as well, about a little over $1,000 total for the entire cost. And then the plans to maintain the solution after the implementation would hopefully show positive results so that we can continue to have this for a long time. The critical appraisal checklist. Yes, our study addresses a critically focused question. The Peacock question was addressed. The study uses valid methods to address this question. Yes, most of the research were randomized controlled trials and all address the question. The valid results of the study are important because they create more awareness for companies to integrate animal-assisted interventions for increased quality of life and quality of care. And then the valid and important, applicable to our patient population. Yes, because it's a perfect setting, although the research is applicable to a lot of populations. This evaluation table simply has the goal in the middle of implementing animal-assisted interventions, and then the task or the to-do list to get them done are in the circles surrounding, which we have just mentioned before. The conceptual model that has been developed has 4 stages, which coincide with the change model that we just talked about and what would occur during each stage. The timeline would start on a Wednesday to where we could meet with leadership, get approval to start, and then the next day on Thursday, set up, collect animal supplies. Day 3, launch our education and training sessions. Day 4, you notice is a weekend. 5 patients that are agreeable to participate. Day 5, make sure we have all of our consent forms collected for the participation. And on day 6, start and actually launch our animal interactions to collect data. This shows with 3 weeks of 5 times a week for the interactions and concluding after a 30-day period. Our resource list is pretty self-explanatory. We need human help for staff participation, patient participation, research project leaders, educational leaders, family members, and power of attorneys to sign and give consent. We will need animals, which will consist of a small cat, a small dog, several fish that will be in a tank, and 3 birds in a cage. The animal supplies that we would need would be bedding, cages, food and treats, water, food and water bowls, tank, and then decor for the fish tank, items that would be needed in the bird cage, toys and leash, and then paper supplies would include educational handouts, consent forms, etc., all those things that we would need to print out and get back. We would also need to have a computer to collect and track the data that is password protected, which would be owned by the research leader, and then the educational model will also be done on that computer. The outline for the proposal instruments, we would begin with the participants, locating who they are in the facility, obtaining the consent, going all the way to the assessment of the data that we do collect, using the pre-test, the survey, the rating scales, the post-test, therapy and activity documented feedback, and scorecard. We'll compile it all together, enter into a PowerPoint presentation, and then have a research paper to conclude. This is an example of what the rating scale paper would look like. There's 4 questions that will be given, asking how important is interacting with the animal to you, how important is owning a pet to you, how important is it to take your pet everywhere with you, and how important is it that you take care of your own pet. This is the test that will be given pre and post test, as well as the rating score will be done as well. Just asking, are animals used in therapy services? Do animals make people happy? Does interactions with animals decrease anxiety? Does interaction with animals decrease high blood pressure? Just trying to test their knowledge before and after the animal interactions actually occur in the facility. Here's the example of the budget plan that we mentioned earlier. So our human help would consist of about $200 extra in labor just for education and training purposes. The animals cost total will be about $500. The animal supplies about $500. Our paper supplies are estimated about $100 to cover consent forms and surveys, etc. The computer and the educational module, as you can see, will be a little less than $100, considering that the research leader would own the computer and be able to develop the module. This is an example of the first section of our consent form that the patient and or the power attorney has to complete for participation. Remember, always in your consent form, it's important to let the participant know what the study is about, what you'll ask them to do, and some risk and benefits as well. So here's the second half of the consent form. You'd want to include if they'll be receiving compensation, make general statements that it is voluntary participation, and their answers will be confidential, as well as having the statement of consent concluded. You'll need to make sure, no matter what their age is, that you're getting consent of power attorney unless your person is able to consent for themselves. This would be an example of what our survey would look like. This survey would basically rate on a scale 0 to 10, again, to use for other information collected as far as how they feel about their quality of life. The scorecard will then be used to collect all this data and information, compile it together in one place for each person, and this is what we'll really focus on, those pre and post scores, to see if they've had any increased quality of life, and it really was beneficial with the interactions. This is the therapist and activities feedback form. They will do this pre and post the interactions, just so that we can see if they feel like they're increasing their participation for therapy or activities, and if they appear to be happier during the facility. So for the evaluation, there was a comprehensive electronic search done for Grand Canyon University's library. The search included English-only published peer-reviewed articles up to 2017 from 1998. The key words were animal-assisted, anxiety, and depression. The outcomes were all measured in the test that we see in the appendices. And then we have the reliability of the measures will be affected by the opinions of each person involved, whether or not they like the certain animal that they are around, or their allergies and things like that. As you can see, we're going through the references just as we finish up the presentation. But the strategies that can be taken if the outcomes don't provide positive results, are trying to use them in another facility, because you do have different facilities that have setups that are different, and things can interact with staff different ways, and even the residents that are attracted to that facility in different ways. And the implications for future practice are that many companies are seeking alternative methods for increased quality of care, and animals can very easily do this and accomplish this. So I hope you enjoyed the presentation, and hopefully if you have any questions, you can post them below, and I'll be able to answer them for you. Thank you for joining me.